Happy Wednesday, happy hump day, that is. This is, of course, your host, Christal Jordan. Thank you guys for joining me. We've been having quite a few interviews over the last few weeks, but I'm hoping that some of them are making you guys more informed about what's going on, and then also just entertaining you because most of us are staying at home and still in the house. So I'm hoping these interviews are giving information that is useful and then also doing a little bit of entertainment. So tonight we're going to do a health check. So this is another serious conversation about what's going on with COVID-19. We thought it was important to keep having these conversations because we're at different stages in what's happening. There are a lot of businesses that are opened up. I was having a conversation with girlfriends last night that are all, their businesses have opened back up and people are afraid, not really sure what's going on. And again, we keep hearing so many different messages. So we thought it would be great to have a doctor join us tonight. And of course, it's always great when we can get an African-American female doctor to come and talk to us about what's going on. So I want you guys to help me welcome Dr. Culbreath to Reality Check. Get her on here. Welcome, Dr. Culbreath.
Hi, thanks for having me.
No, thank you so much for joining us. Like I said, you are, you have a PhD in microbiology and immunology. So this is exactly what you do. You specialize in things like this. You're currently the scientific director of infectious disease and research and development in Albuquerque, New Mexico. So I'm sure you've been very busy right about now, right?
Yeah, very, very busy. We've been working even before we had cases here in New Mexico and cases around the country. We saw what was happening in China and then later on in Italy. So we've been really pushing to develop the tests that are used to diagnose people with COVID-19.
Okay. Now, and that's, of course, what everybody wants to know, what is going on with the research of the vaccine. But before we go there, can you kind of explain to us what happens? Because there's been a lot of conversation about, were we prepared for this? Did we know this was coming? I know there's clips of President Obama mentioning that, if a pandemic did come, we were not prepared. So how, from your standpoint, how does that work? And how were we ill prepared for this? Did someone drop a ball, or was this just kind of like one of those things that you don't have control over?
Yeah, I think it's an interesting question. I think, from a national standpoint and having a whole strategy, right, a federal strategy, I think that preparation is certainly being called into question, and there'll be hearings for a long time to discuss those things. But I think those of us who are boots on the ground, we have been thinking about this all the time. And as recently as I think we all probably remember swine flu, had a pandemic 1.0, baby pandemic, and we saw where our gaps in readiness were at that time. And so now I think you do the best you can to be prepared, but there's always something that changes and catches you off guard. What we do in the laboratory is really ensure we're ready to respond and respond quickly. I think many labs were able to do some of that, but some places just really had not been able to make the type of response they needed.
Now, what's the difference? Because, we've heard of swine flu and SARS and different things that have come up in kind of, but nothing can compare to this. This feels like Outbreak, the movie, right? Right. Like a sci-fi film. So what was the difference between those viruses and COVID-19?
Yeah, so I think this virus is the combination of the things that we all fear, right? So we fear a virus that is highly infectious. And so that it can be transmitted to many people. One person can infect many people, even before they know that they have the virus, right? Once you know you have the virus, most people would just stay home and they would have their illness. But because it's highly contagious, and one person can infect many people before they are having severe enough symptoms to have them go to a hospital. And then the other part is that the pathogenicity, so the ability of it to cause disease and to cause severe disease. And so those two things really created the perfect storm with this virus. So that's what separated it from, say, the 2009 H1N1, the swine flu. It infected a lot of people, but didn't really cause too severe of a disease. And then, something like the SARS-1 or Ebola even. Somebody has it, they got sick very quickly. And one person got sick, but they got sick very quickly, and so they went to the hospital. So those two kept them on the edges. This virus, COVID-19, gets us into that perfect storm.
Wow. Now, I've heard also that it attacks both lungs and the way it progresses, because like you said, people are getting sick and some people are dying very, very fast. So is that something different for it to, I mean, we've heard it attacks both lungs at the same time. It shuts the immune system down. I've heard it causes blood clots. Like, are all these rumors? Is all this true? Sounds like a really bad movie if that's the case.
Yeah, no, it's very good at what it does, right? So it's a highly pathogenic virus, and it's been elusive, right? It's new, so we don't know all of the things that we should be looking for. The symptoms, even the symptoms that we are tracking, those evolved over time. First, it was just the cough or a sore throat or a headache. Now it's even progressed to a common symptom that's being seen is the loss of taste and smell. Is a symptom that's emerging. We're seeing new symptoms in pediatric patients of a rash on the feet. So we're just learning about this virus really every day.
Wow. Well, that brings me to my actual first official question, which is with us realizing that doctors and scientists are learning along, by trial by fire. And we've opened up a lot of states and a lot of businesses. I mean, essential workers were still working, but a lot of people are back, working and being outside now. What can we do, knowing that in some capacity we're going to have to work along with this virus before there is a cure? How can we, feel confident in going back to work and going back to our daily lives?
Yeah. Well, I mean, what we know is that the virus isn't invincible, right? So the virus has weaknesses, and soap is still working all the time, right? So continuing to use hand washing techniques and washing our hands well, and hand sanitizer. I think the social distancing, we're going to see things change in our everyday life, the way that we work and interact with people. I think it's going to change even as we go back to work. Social distancing will still be a part of our lives. So I think we have to be careful. I know there's been early conversation about using a mask or not using a mask. I think that there's value to having a mask on, and at least it continues to raise our awareness. But a mask does not replace social distancing. So you can't put a mask on and then be, in from somebody. So put the mask on plus social distancing, and that
I feel today I was in the store and I felt, I had to walk, by people in a close proximity, and I felt a little bit more comfortable because I did have my mask and my gloves on. So it does kind of give you a false sense of security because, you feel like you're protected a bit.
No, you still have to have that space. When I've been out in the store, I do kind of notice when I go down the aisle, if there's already two people in the aisle, I'm like, maybe I don't need that right now. I'll come back later. So we have to still put social distancing together with wearing a mask. We can't go to the club with a mask on. Like, that's not good.
Thank you, Dr. Culbreath, for clearing that up. Now that brings me to one of the things that's really bothered me about just the narrative. And I think it's really important for us as African American media to properly support and inform our community. So, there's been a narrative out that has basically said that African Americans have a much higher, are dealing with the disease or the virus at a much higher rate. Can you explain to us why that is the case, or in your opinion, why that's the case, and what we can do to stop that? Because I do see a lot of people out without masks, but I see those people from both sides. I see African Americans and I see Caucasians and Hispanic Americans and Asian Americans. I see people out without masks. So why are we hearing that the virus is disproportionately affecting our community in such a large way?
Yeah, so what's really interesting is, so I live in New Mexico, so we don't have a huge African American population, but we do we have a big Native American population here.
Okay.
And the virus is really attacking those communities. And then in other areas that maybe have larger Hispanic populations, the virus is attacking that. This is really a health disparities issue. And what the virus is revealing is where there have already been issues with health disparities and determinants of health. It is just shining the light on the problems that have existed here forever. So there's no legal component to this. It's not our fault as a society or as a group of people. This is a problem of systemic racism in healthcare. It's a problem of recognition of symptoms and disease and severity of disease when a person of color, African American, Hispanic, Native American comes to the doctor. Are they with the same level of care? And we've seen in the data that that doesn't happen, that when individuals complain of pain, they complain of even shortness of breath, chest pains, African Americans and other people of color are dismissed at a higher rate than their Caucasian counterparts. It's an issue of systemic racism in healthcare that has existed long before the virus. The virus is just revealing what's always been there.
Thank you. Thank you so much for saying that. I think that's a very powerful, clip from this interview, is that this is revealing a systemic racism that has been, especially in the healthcare industry, for quite some time. Understanding that, what can we do moving forward? Do we need to have more education in our communities? How can we stop this? Because it bothers me when I hear people saying, well, African Americans are more at risk for diabetes, heart disease, hypertension, it's like every single thing. So what can we do as gatekeepers of our community and the voice of our community to help just put a stop to this and reverse this systemic racism that's been in place for so long?
Right. So I think we have to continue to advocate and have advocates in every area, right? Like yourself, advocates in media who shine the light on what's happening and kind of help us to see what's there. And so I think that's huge and important. I think we have to continue to raise awareness within our communities and know that we have to advocate for ourselves. And go into those spaces, into those community spaces, into those faith spaces, all of those areas, and start to speak on the issues and help people to advocate. I think long term, one of my passions, of course, is STEM education. So I hope this is inspiring a whole generation of scientists and doctors and vaccine developers in the future. But we have to make sure that we're represented and we're at the table when those decisions are being made, and when the decisions are being made of where do we put testing sites, when the decision is made of, what are the policies, there has to be adequate representation so that we can bring up the issues. Other people may not see the things the way we see it, so we can bring up the issues in that way.
Absolutely. Absolutely. If you're just joining us, of course, this is Christal Jordan rolling out, and this is a health reality check midweek as we check in with Dr. Culbreath. She's a scientist and pathologist. She's here talking to us about what we can do to better prepare ourselves to deal with this, because it looks like we're going to be dealing with COVID-19 for a while. I want to ask you, Dr. Culbreath, how important and what role do diet and lifestyle play in us being susceptible and dealing with some of these issues, especially viruses like this?
Yeah, I mean, there's data now on, many respiratory viruses. And I think, there's the common things. There's some things, science tells us, but there's some things, our grandmas and moms and everybody's, been telling us for years, getting a good night rest, eating healthy food and having more plant-based choices in our diet will always serve us better. So I think we have to focus on how well we're taking care of ourselves during this time. And the other thing that I do just want to point out is that, there's COVID is going on right now, but there's still all of the same underlying health issues that the individual may have. So I think we have to just be conscious of the way that we're eating, getting enough sleep. This is a stressful time. Last night, for me, was a restless night of sleep. I was dreaming of work and this and that. I mean, there's a lot of anxiety and a lot of stress we're carrying. And when we carry anxiety and stress, we don't sleep. We get up and we eat in the middle of the night. We eat all day long. so we have to be conscious of those things that we do
Right.
have some control over, figure out how to deal with them.
That's a good point. This is May is Mental Health Awareness Month, and I think that we all, in different ways, have been dealing with anxiety.
Yes.
Just from this virus and what it's done to our lives, between people being out of work to other people really dealing with, not being able to have human contact or interact with their friends and their families. What would be a suggestion for people that are dealing with a lot of anxiety and stress and may not know how to do that, may not even understand that that is a mental issue, at some point? What are your words for them?
Well, one of my closest friends is a mental health professional, and she is still seeing people via telehealth. So I think that this is still a great time. There's no time like the present to find somebody who you can talk to. I know so much in our community, we're starting to utilize mental health services that are available to us, but I think we still need to do more, and we still need to reach out and talk about those things, because the issues, right? They're there. They've probably been there a little while, but we've all had some coping mechanisms that we could go back to. Sometimes it was like, well, I can just work all day and I'll achieve at work, or I'll be able to do this, I'll be able to do that. We had ways to let off steam and deal with. Now almost all of that is taken away, and we're having to just sit in ourselves.
Yeah, you can't even go to the gym at this point. You can't go to the gym.
That's it to do. So we're sitting in ourselves, right? Sitting in our stuff. How do we deal with that? I'm a person of faith. And so I think, even though you may not be able to experience your worship or your faith time in the same way that you have before, there continue to be ways that you can go into your own personal solitude and spend time in those spaces. And I think that's very healing for me. And being outside safely, I think, is very important. I keep telling people I've become a pandemic hiker. I find, a place that I can be outside, secluded away, if it means I have to drive for 40 minutes. But I'm secluded and I'm away and there's no other people around, but I can just sit in the beauty of nature, do some journaling, and things are better and things are good. So there's things we can do. Everything is not off the table.
Right. I love that. And I think that one of the things it has done is made us go back and appreciate those things that we cannot buy. So being able to go outside and it be a beautiful day, we're like, oh, it's a beautiful day, thank God, because we're having so much else is going on. You go outside and you just see it. It's beautiful. It's just a huge relief. So I think it is making us reconnect. It's reminding us how important our relationships are, how they really can be a rock for us, in times of stress. Moving forward with this pandemic and the likelihood of other things like this coming, I know that there's maybe not conclusive research on if this was man-made or what, and maybe that doesn't even matter. But in your opinion, do you think that we will be seeing other things very much like COVID-19 moving forward?
Well, I don't know. I for one, I sure hope not. This has been the hardest couple months. I don't even know. It's some days it feels like it's been 10 years, and I look up and it's only been 2 months.
It's a very long 2020 so far. Like I feel like it's been about 5 years in this 1 year.
It's going forever. But I think what we know is this is a global society, and so what happens in one place impacts here. And it's not just the past 10 years. We've had SARS-1 that didn't really pan out too much. Great. We had the 2009 swine flu. That was a little bit of something, but we made it through. We had Ebola that was knocking at our door, but because of the nature of the virus, we were able to handle it. And now we're here with COVID-19. History lets us know that there will be other pathogens that knock on our door. What we have to then do is, what did we learn from this? How do we respond differently, both as individuals and nationally? I think it points out how important it is to have national leadership that takes science seriously, that respects science and respects science. So hopefully that helps to govern how people select who they choose to vote for in the future.
We would hope. We would be hopeful. We would be hopeful that this is an example of why that's really important. I want to, there's so many things I want to ask, but I always comes back to just our community, because I feel like we are dealing with it in such a different way, even in having the right information. So if you're having these symptoms, because now I hadn't heard about the rash on the bottom of the feet, but if you're having symptoms, or you're thinking that you may have a symptom, how important is it for you to be tested? And is there a safe way to do that? Are you suggesting that people immediately go get tested? Are you saying that they should wait until they feel more symptoms? What should be our barometer for still being tested for the virus?
Yeah, I think if people are feeling like they have any of the common symptoms, certainly fever, cough, shortness of breath, like I mentioned, the lack of smell and taste is an emerging symptom, sore throat. These are all symptoms you should go. Every state has a website where you can go and look at your symptoms, and many states have hotlines you can call. Your health plan or doctor's office likely also have hotlines where you can call. And I know testing sites are really popping up all over the country. Here in New Mexico, we have several testing sites that you can go and you can get tested, really with very limited symptom presentation, but have to go get tested. I think that's the one thing as a community we can be in charge of when it comes to our health. We should encourage, sometimes, I mean, I can speak to this as a daughter of a very stubborn Black father. We need to make sure, hey, go to the doctor. We need to do, that's one thing that we're in control over. And so we need to help to encourage people, go get tested, do it now, and do it again if you feel the symptoms haven't changed.
Okay, because that's we see people are being tested once and getting a result that they don't trust, and going back and being tested again. Last question, because we mentioned, I think it's really important to highlight that this is an issue that has been happening for a while, kind of a buildup. So when we have African Americans that don't go to the doctor, but yet we know that when we do go to the doctor, we're not treated the same. What suggestion can you give us from a doctor standpoint? What checklist should we be looking for? What do people need to, how do we know to speak up if we're not getting the right treatment? Because I think a lot of, most of us as lay people, we don't know when we're being told something that's not right, or, maybe even if we're not being treated fairly. So what is maybe a couple of tips that we could look for so that we can start to close that gap, and we can stand up for ourselves and make sure that we're being treated correctly, we're getting the right information, and we're being able to develop, being able to be more conscientious of our own healthcare?
Yeah, so I think the first thing, one, is to be as educated as possible going into the door, to be able to say, these are the symptoms that I've been feeling. I think, we have to, unfortunately, we have to go in armed with more information. So these are the symptoms I've been feeling. This is how long I've been feeling it. This is unusual for me, and I need you to do something. We have to be firm. Most times I would tell you to bring somebody with you, but now we can't. So if you can have somebody on FaceTime, Duo, whatever, Marco Polo, and have somebody on with you so that they can also hear what you're hearing. I think that's really helpful, because then you can have somebody who can help to advocate for you. I think the most important thing is to trust your gut. And if you feel like, no, something is really wrong, you need to keep pushing and keep pushing harder. And I tell people, push as hard as you would for your own child, because sometimes we'll advocate for our children, our parents, and others more than we'll advocate for ourselves.
Absolutely.
And I think as women, advocate like it was your child who was sick. Advocate for yourself at heart, because advocate that strongly.
Yeah, that's key. That's key, because as moms, that mother bear comes out and it's like, there's nothing. I don't care what that doctor says. You're gonna tell me again. You're gonna tell me this way when it's for the child. But you're right. We definitely don't. We don't always put ourselves first. So I just want to thank you for taking the time out to have this conversation, because, again, Dr. Culbreath, a lot of us, if you're not a doctor and you're not a scientist, things sound very confusing, and it can be very unsettling, especially when you're out there and we're learning how to kind of approach this new way of living, this new normal with this virus. So I appreciate essential workers like yourself being able to really share with us as you do your work. So we salute you for what you do. It's important for us to see people that look like us in science and in the field that you're in. Behind the scenes in STEM, it's definitely important for us to see African Americans, but also women being represented. So we salute you for all that you do for that. And just want to thank you again for granting this interview. Is there a place people can get in touch with you or can reach you on social media?
Yeah, I'm on Twitter, Carissa PhD, Carissa C PhD on Twitter.
Awesome, awesome. Well, again, thank you so much, Dr. Culbreath, and we wish you a great rest of the week.
All right, thanks.
Thank you.
Bye.
Well, thank you guys for joining. I hope that was some information that you can use. I definitely think hearing from a doctor's perspective that this is an issue of systemic racism that has been in the healthcare industry for quite a while, and maybe this is an opportunity for us to see that that's the case and to be more educated about it and be more proactive about it. I hope you've enjoyed the conversation. Please follow Dr. Carissa for more information and join us. Friday at 2:30, we have a very special conversation on mental health awareness with a friend of mine, Shanti Das. She has a wonderful nonprofit that's shining a lot of light on mental health awareness. So you don't want to miss that conversation Friday right here at 2:30 p.m. Eastern Time. I'll see you there. Enjoy the rest of your evening. This has been Christal Jordan with Rolling Out, and I'll see you guys next time.